We begin tonight on Capitol Hill, where lawmakers grilled Health and Human Services Secretary Robert F. Kennedy Jr. about changes he has made since taking office. Unlike the usual partisan show, the pointed questioning came from both parties, and particularly from two Republican doctors who backed Kennedy's confirmation.
I support vaccines. I'm a doctor. Vaccines work. Secretary Kennedy, in your confirmation hearings, you promised to uphold the highest standards for vaccines. Since then, I've grown deeply concerned.
I would say effectively we're denying people vaccine.
Congressional correspondent Caitlin Huey-Burns joins me now from Capitol Hill. Caitlin, what were basically the main criticisms of Secretary Kennedy?
Well, John, it was striking to hear from two doctors on the panel today who are Republicans, who are allies of President Trump, and who supported Kennedy through his confirmation process, raise concerns about the messaging around vaccines. You heard that there. And what was notable today was the focus was especially on the availability of the COVID-19 vaccine. Remember, just a few months ago, the FDA issued guidance saying that it would not make it available for those unless they were over 65 years old or had an underlying health condition. And so Kennedy was pressed on that as well. And he was also pressed on the firing of CDC director, former CDC director, Dr. Susan Menarez. He called her a liar after Menarez said in an op-ed today in the Wall Street Journal that she was asked to essentially rubber stamp new recommendations from this vaccine panel. And Kennedy said that that is not how it went down. And now lawmakers want to hear from Dr. Menarez as well.
Any clarity from the secretary on this COVID question, the vaccine question?
Well, he was asked by Senator Elizabeth Warren, if you want to go into a pharmacy and get a vaccine, can you? And he said yes, but she said that actually is not true because of the guidance. And then he responded saying that he didn't think that it was essentially necessary because of how everything has developed. So that remains an open question, and that is what we're also hearing from pharmacies about making this available. Now, just in a couple of weeks, at the end of this month, that vaccine recommendation panel will meet, and they will discuss recommendations not only for the COVID vaccine, but also for a variety of other vaccines, including those for children.